Welcome to the Princess I'm Possible show. Here's your host, Princess Jones.
Welcome to the Princess I'm Possible show. We have a delight today. We are here with Dr. Deborah Deas. She is the Vice Chancellor, the Mark and Pam Rubin Dean of School of Medicine and Professor of Psychiatry at the University of California, Riverside. Welcome, Dean. It is wonderful to see you, and thank you so much for taking time out for my viewers because we know that you're very, very busy, so we're going to just go ahead and get started.
Well, thank you so much for having me. I'm just delighted to be here today.
Oh, this is a treat. Oh my gosh. And what I'm really excited about is we're going to get more in depth as to the medical field, and especially here at the University of California, Riverside, because it was a hard-fought battle to get it here on campus, and the things that you have done since you've been here, amazing, and my viewers are getting ready to find out. So thank you, Dean Deas. So Dean, you chose the medical field. Why the medical field? Who inspired you?
Sure. That's a great question, and it's one that I've talked about often. I chose the medical field because I was influenced by my grandfather, who was 98 years old when he suffered from a stroke.
Okay.
And prior to that time, my grandfather would talk to me about becoming a lawyer because in my community, we didn't have lawyers, we didn't have doctors, and I was on that path, at least in my mind, wanting to become an attorney. And I was 12 years old, and my grandfather had a stroke, and I participated in his care.
Okay.
I was there at his bedside, and he said one day, you know, I really think you would be a great doctor. At that time, I didn't know of any physicians who looked like me. I'd never seen an African American physician, but he felt that I could do it. And from that day, it was in my mind that I would become a physician one day.
Pursue that. That is awesome. That is wonderful. And, you know, as you're speaking, I could see it in you, you know, just that wantingness, the wantingness to help. And especially for something like that, because that would spur you even that much more to just go and say, well, you know what? Medicine is important. Look what happened to my grandfather. I can help others, maybe in his position, or I can help. So that is wonderful. Well, thank you for sharing for that for you. Grandfather, thank you for your direction. Okay, well, upon arriving at UC Riverside back in 2016, your appointment as dean made you the first female African American dean of medicine, the medical school in the UC system, as well as the first African American and first African American female dean of school or college of any kind in the UC system. What impact would you say that made on the UC system overall? The fact that you're the first African American, the first African American female, you're a dean. What type of impact would you say that has made?
Sure. Well, Princess, we all know that representation matters. It really matters for people to see that there's someone like me who could be Vice Chancellor and Dean of a medical school. And while I was the first female African American dean in the UC system, I hope that I'm not the last. And I hope that I serve as an example of what one can become to my students, to the faculty, and to the staff, that we should eradicate those barriers that may have been in the way that prevented more African Americans from becoming deans of vice chancellors. And I just feel that the pathway is open. And it's open for people to step into. And I hope no one feels that there's a limit in what they can do.
Right, exactly. And now I'm going to speak personally now because you're a trailblazer. You know, to be the first, you're a trailblazer. How did that make you feel personally to know that because of what you started, you have opened the doors for others, and like you say, that look like you, look like me?
Absolutely. Well, I felt that I was answering a call, and that call started with my grandfather when he called me and said, "You can do this." And my parents and my grandfather instilled in me that if you put your mind to it and you do the work, you can do it. And don't let anyone stand in your way. So while I didn't think years ago that I would be a dean, I knew in my heart that if I wanted to do something and became determined, that I could accomplish it and that I would not allow barriers to get in the way. Now, saying that, there are barriers all the time, but you have to be willing to push against those barriers and to overcome and to fight against, in some cases, the barriers that may prevent you. And it may not be becoming a dean in the community that you were raised in, but just think of me. I came from the East Coast all the way to the West Coast to be a dean. And if geography was the limit, then I probably wouldn't be the dean today because the calling was all the way on the West Coast.
See. And you know, as you say, barriers, because that would have been a geographical type barrier.
Yes.
You overcame that. So, are there any other barriers that you may want to share with us? You know, maybe another one, something that you felt that, you know what, society or whomever is trying to prevent me from making this step, but I'm going to get through it. Whether I got to go through, around, over it, under it, but I'm going to achieve it.
Right.
What other barrier would you say that
Well, I think other
came about?
barriers may be institutions' readiness for change. And some institutions are not ready to make that change and to open the doors to diversify the institution. Now, if that is a barrier, it shouldn't discourage you such that you give up because there are many institutions out there. And I would say UCR is an institution that was willing to open its doors and to embrace diversity, equity, and inclusion. So some people might say, well, I'm not getting a job because they don't want me here. They are putting barriers. That's that one job, but there are multiple jobs out there. So when you're blocked at one door, you look for another door to open. Yes.
That is wonderful. And to my viewers, please take all of this in because the information that Dean Deas is giving, I mean, you could go to school forever and not learn what she's giving because she's giving the insight. You know, you can go to school, you can learn, you can theory, you can do all that, but to have someone that's giving you the insight, that makes a difference. So Dean, under your leadership, the University of California, Riverside School of Medicine has seen tremendous growth in its medical education, biomedical sciences, and clinical enterprise programs. What did you do to elevate this growth in those different areas?
Well, in anything that we do, I hope we know that you don't do it alone. This did not happen because of Dean Deas. It happened because I was able to bring a team together to work collaboratively and cooperatively towards a mission. And we have a lofty mission. The mission of the School of Medicine is to train a diverse physician workforce and to create programs in research and clinical care to serve the people of the Inland Empire. And if you were to break this down, to train a diverse physician workforce, create programs to serve, and I feel that the operative part of that mission is training a diverse physician workforce and serving. So what I was able to do was to facilitate,
Okay.
to bring this team together to facilitate this growth. And the people who are here at UCR School of Medicine showed a commitment to this mission.
Okay.
And because of that commitment, we were able to grow the education program. We expanded or increased the number of medical students. We increased the number of graduate medical education programs. That's the residency programs, those trainees. And those trainees that are training in the Inland Empire, about 47% of them remain in the Inland Empire to serve as physicians after they complete their training.
And you know, that being said, that is huge because a lot of times you have students that go to school wherever it is. Once they have gotten their degrees, they leave. They leave. But to stay within the realm of where you received your education and to give back, that is something that, I mean, that's powerful.
And that's
powerful.
needed here
That's
in the
powerful.
Inland Empire.
Yes,
When
yes, it
I
is.
joined at that time in 2016, there were 35 primary care physicians to 100,000 population. And what is recommended is that we have 60 to 80 primary care physician to 100,000. So you can see how far behind. We need primary care physicians in the Inland Empire, and we need specialty care physicians. I'm pleased to say that today it has increased from 35 to 100,000. We now have 41 to 100,000. And I can't help but believe that we at UCR School of Medicine have made an impact in bringing physicians who will stay in this area to serve.
That within itself is just amazing because when you listen to those numbers, when you're looking at, you said 100,000 people, that's a lot of people. And if you only have a few physicians, they can only do so much. And then, you know, us as the general public, when you go in and you see a doctor or whomever, and they say, I only have 15 minutes. I've literally heard doctors say, I only have 15 minutes to give to you. So if you have some serious issues and someone says 15 minutes, but now because you were able to expand it and the students stay, that is amazing. That's powerful because now 15 minutes parlays into 20, 25, 30. Now they really can help and do what they're supposed to, what they're trained to do. So that is wonderful. Well, representation, Dean, of minority and underrepresented students tend to be very low in the medical field, and that's really unfortunate. In March 2021, the School of Medicine was recognized by the U.S. News and the World Reports of 2022 Best Grad Rankings as number 6. I will repeat that, number 6 in the nation diversity. I mean, that I'm beyond myself with that because when you're looking at the nation and you're saying number 6, and that's nationwide, that's powerful. With 34% of 299 medical students and 32% of biomedical sciences students coming from underrepresented minority communities. How did you achieve that goal? Because that, I mean, listen to those numbers, and to be number 6, and we're talking nationwide.
Absolutely. Number 6 nationwide, that it is exceptional because we're talking about schools that have been around since the 1800s. We are talking about schools that have been around for 50, 60 years or more. And UCR School of Medicine opened its doors to our medical students in 2013. But it goes back to that mission, training a diverse physician workforce. How do we train a diverse physician workforce unless we have a diverse body of students?
Right, right.
And it's a team effort here. We are very intentional about our mission, about training this diverse physician workforce, and we use what we call a holistic admissions process. We don't just look at the grades or the MCAT score, but we look at the entire person. And some of the factors that are considered in our admissions process, we want to attract students who grew up in the Inland Empire. We want to attract students who may be first in their family to graduate college, our first generation student, those who come from socioeconomically deprived backgrounds. All of those characteristics are factored into our admissions equation. And when you look at all of those things as a whole, there's a lot of diversity there.
Now, when you mentioned holistic, because
Yes.
a lot of times, people think it's medicine, you go in, you have to, it's a certain way, and that's the only way. But holistic is, there's a little difference when it comes to holistic. Can you explain that?
Oh, absolutely. Years ago, when an individual wanted to apply to medical school, they often thought that I needed to major in biology. I needed to have a science background. With our medical school and many others now that have come on board, you could be an English major. You could be a fine arts major. And you then take some of the science courses that are necessary for medical school. But we don't put you in a box and say you have to be a science major. What we've learned over the course of practicing medicine is that the humanities are important. When a physician goes in, as you described, the 15-minute appointment, and when that physician is talking to you as a patient, he or she needs to be able to communicate. They need to have interpersonal skills. So in order to do that, we bring students from various backgrounds together, and these students can make great physicians as well.
Now, that's because you're making mention of, I know that's UC Riverside. Is that here just UC Riverside, or is that something that's really starting to spread amongst the other medical schools? Because as you said, every time, I know when I was in college, every student, they had to be biomed, it had to be science. They honed in, and that was it. You did not hear about the arts or being in any other any other field.
I would say currently about 90% of the medical schools in the nation would use this approach, where you do not have to be a science major as long as you take the necessary science requirements to take the medical college admission test. However, the medical college admission test has also changed, that it incorporates the social sciences into the exam, so the student who is a science major can't get away from taking the social sciences. So I would say as a nation, we have gotten better in looking at what makes a great physician.
One of the last questions I do have to ask, there's a lot of medical schools out here. So what makes UC Riverside any different from any of the other medical schools?
Well, I will tell you quite bluntly, it's our mission. A mission like one that we have to train a diverse physician workforce and to create those programs to serve the people of the Inland Empire. It's a special mission. And students, faculty, and staff are attracted to this medical school because of its mission. Students know that when you get in to UCR School of Medicine, you are indeed joining a family. And as part of that family, we wrap our arms around our students and we say, you have joined us, and we will do everything in our power to make sure that you get the best possible education and that you graduate from UCR School of Medicine. And as a result, our graduation rates are upwards of 98%. Our success rates, pass rates for the medical board is about 95 to 98%. And we make sure that these students are successful. To think that many of our students come, about 50 to 60%, come from the Inland Empire. And these are students who are graduating and they're becoming physicians. Not only are we changing their careers, but we are increasing their social mobility, changing the level of their economic platform, not just for that student, but for their families. So we are really making a difference. And I can say that's the difference between other medical schools and UCR School of Medicine.
See, and that's wonderful. And I think that goes back to what we were talking about, that personal touch. Because a lot of times when you go to school, you feel like you're a number. You feel like, who's here to help me? I have issues. Whatever it is, I'm alone. But when you have someone, like you said, it's a family unit, then you can say, okay, I have help. I have someone who cares. And then that can catapult you into another arena and say, you know what, I can do this. I'm going to finish.
Right.
I'm not going to be a statistic. I can do this, like you said earlier. That is wonderful.
And all we ask of our students is to pay it forward. Pay it forward by bringing other students along. And in our pipeline programs, we start pipeline programs from elementary school on. So anyone could be a part of this family.
And that, and you know, and I'm just going to be a little biblical. It states, and I sound like Michelle Obama too, to whom much is given, much is required. As Dean said, they're helping you to get where you need to go. You need to give back. You need to give back. Well, Dean, last question I want to ask you. What advice would you give to the viewers that are interested in entering the medical field? What are the first steps, and what would you recommend for the viewers? Because we've got some out there. We know that you're looking into the medical field. We know that you're looking into the psychiatry field. Whatever field it is, we're getting ready to get it firsthand. So hopefully you got your phones out, your recorders, whatever it is, because you're going to get it firsthand from Dean Deas.
Well, first and foremost, there's a lot of room in the health professions, and we need students in all areas of the health professional schools. Dentistry, physical therapy, medicine, you name it. Any field that you decide that you would like to go into is ripe for success. And secondly, you can do this. You can do it. Of course, it takes hard work and it takes studying. But think about me. I did it. I grew up in a rural community. My parents were farmers. I'm a first-generation college student. And they instilled in me that I could do it. And I hope that my presence here suggests to you strongly that you too can do it. We have pathway programs through the Association for American Medical Colleges. That's AAMC, AAMC.org. There is an entire program for aspiring docs. You could go online and get information from that program. You certainly can contact UCR School of Medicine, and we will inform you about our pathway programs. And those pathway programs start from elementary school, and it continues until you become a practicing physician. We're here to assist you, so there shouldn't be any excuse about not having information. The information is right at your fingertips, and you have a cadre of people here to assist you to become a health professional.
That is wonderful. Now, to my viewers, you got it firsthand. Dr. Deas, Dean Deas, she is the Vice Chancellor. I mean, you're talking about the epitome of a medical school, and you got it firsthand. She just gave you the roadmap that what you need to do. So get up, get off that couch, get the education. She gave you the website. She said contact UC Riverside. Let's get it done because we need you. Get into that medical field because at this point we still need more doctors.
Absolutely.
We still need more doctors.
Right, and at UCR we have an open house every year in the spring, and it's for our community. Please join us for our open house this spring of 2023. And at the open house, you'll get lots of information about pursuing the health care professional fields.
See, that is wonderful. And Dean, we can't thank you enough for this information because you know, a lot of times when people think about medical schools, UC Riverside is not really on the radar. UC Riverside, it's on the radar now.
Well, thank you, Princess, for making it happen. Thank you.
It's elevating. So thank you so much for your time. We appreciate it. And again, Dean Deas, she's giving you the information. Let's get it done. Again, thank you so much for your time. I appreciate it.
Thank you.
Thank you.
Okay,
thank you. Thank you.
Next week is part 2. We are excited to give you a personal tour of the Center for Simulated Patient Care at the University of California, Riverside School of Medicine. You don't want to miss it.
We want to thank our guest and thank you for tuning in. Next week, we have an exciting show just for you.